Hello everyone. Recently, there has been an announcement regarding the change in the NEET SS exam format, and everyone is very upset after that. But there is no point thinking about it because the change has been for everyone. Even the top rank holder is going through the same thing, and everybody is in the same condition. So, what all we can do is we can just go ahead with our preparation of the general surgery. And what the WISE team has decided is to help out all the candidates who have been associated with the WISE team over a long time with a few general surgery lecture series. We are trying to provide you with as many topics as possible, high yielding topics from Bailey and Love, Saviston and Shorts, so that apart from what you're revising the whole day, you are able to revise or add on a few points from this high yielding topics, so that over the last month we can update you about the upcoming pattern of the questions which will be asked. And let us adapt to this change. Let us quickly understand what the new format of the paper is going to be, and let us understand a few things which will be covered in the general surgery lecture series. I am Dr. Ankit, starting off with the first lecture on response to injury. See, the response to injury has been a very important topic for NEET SS, and there are always a very few questions asked from this. But keeping in mind the change exam format, keeping in mind that this chapter is the first chapter in Bailey and Love, we have to keep this chapter as a very high yielding topic for the exam as a last minute revision. So what we are going to be asked from this chapter, we are just going to understand a few points, few concepts that has to be very, very important for the exam. So response to injury, whenever the body undergoes any injury in the form of stress, whether in the form of surgery or any kind of trauma, whatever be the injury to the body will try to produce certain alarming molecules, and these molecules are known as the DAMs, or the damage associated molecular patterns. So these DAMs are the alarming molecules which are released into the blood whenever there is an injury, so they detect the injury. So very important exam question will be, what is the most characterized, or what is the most important dam that is produced in response to trauma? So that is the HMGB1. We can see this quote from the Saviston, which clearly mentions that the best characterized dam is HMGB1. So what is HMGB1 stand for? High mobility group B1. This is a protein molecule. This is a non-histone chromosomal protein molecule. And another very high yielding MCQ that I can see in this paragraph from Saviston is that the HMGB1 molecule is released within 30 minutes of injury. So two important MCQs in one slide. Number one, which is the DAMP molecule most commonly released? That is the HMGB1. And what is the time it is released within? It is released within 30 minutes of injury. So the body underwent an injury. It released certain molecules in the blood, and this is known as the most commonly being the HMGB1 molecule. Now, two more important points about this HMGB1. See, this is mentioned from shorts. We cannot ignore shorts because there are very important high yielding things in shorts which has to be covered simultaneously. What does shorts mention? The two important things. Number one, it is a late in mediator of inflammation. Number two, it induces sickness behavior. These two things about HMGB1 we have to understand. So there are four MCQs about HMGB1. If you get in the exam about DAMPs, about HMGB1, you have to be very confident. Next, once we understand how the body detects the response in the form of increasing the alarming molecules, we have to understand that these DAMs which were increased in the body, they were the endogenous molecules. Now there are some exogenous molecules also which can increase in the body after stress, and these are the pathogen associated molecular patterns known as PAMs. So whatever be the molecules, whether it's a endogenous or the exogenous, all these molecules are going to bind to the pattern recognition receptors. They bind to the receptors which are known as the pattern recognition receptors. Again, this is a term which has been picked up from Saviston. Try to understand there are four common types of pattern recognition receptors. So a question which might be asked is, all of the following are pattern recognition receptors except, so just remember these four names. toll-like receptors, nod-like receptors, calcium-related receptors, and the receptors for advanced glycolytic end products. All these four receptors are important. Now try to understand. Molecules have been increased in the blood in response to injury. They bind to the receptors, and now what they will do? These receptors will now stimulate the further reactions that occur in response to trauma. We will understand that in the next slides. Now try to understand. Another high yielding MCQ is see DAMP molecule, the most common being the HMGB1 molecule. Now there are other DAMP molecules also which might be asked in the exam. So try to understand the other DAMP molecule also. This is a list of the DAMP molecules which is given in shorts. I know this is a very difficult to remember this, but have a look through this. At least if you go through it once or twice, you will be able to rule out the options. They might ask you which is not a DAMP molecule. Then you should be able to rule out the options from here. Which is very important, I feel, is uric acid. I feel is heparin sulfate. They might ask you these questions, which are the DAMP molecules. So you should be able to remember at least these points. Rest of the points also go through them once. I think you will be able to remember them if you have a visual impression of them. Next, the molecules have bound to the receptors. Now, a few important point about a receptor that is not like receptor. Now, try to understand this statement has been taken up from Saviston. Now, it clearly mentioned that the nod-like receptors, they assemble to form a structure which is known as inflammasome. Inflammasome, I feel, is also a high-yielding MCQ. Why inflammasome is important? Because the inflammasome is mainly responsible for sterile inflammatory process. Now, try to understand. Very important question. Inflammasome is responsible for sterile inflammatory response. So this will be responsible not for sepsis. They will be responsible for metabolic diseases, for atherosclerosis, and for neuroinflammatory disorders, or for any inflammation that is sterile, as in cardiomyopathy. So whatever be it, remember nod-like receptors, most commonly nod-like receptor P3, they are responsible for sterile inflammatory response, which is formed in the form of inflammasome. Once we have understood about the receptors, the molecules which bind to the receptors, now try to understand about the inflammatory response that is produced. Now see, once the molecules bind to the receptors, they initiate the inflammatory response, and the most common response that we already know is about the systemic inflammatory response syndrome. We read this in detail. There are multiple times we have come across this, but there are few important points that are frequently missed by the candidates are among the criteria, there is a mention about PaCO2, which is should be less than equal to 32, or there is more than equal to 10% immature band forms. The other criteria, we have read them multiple times and we remember them. But these two criteria are frequently missed, and so they're important to remember. So I've highlighted them. The rest of the things about sepsis, severe sepsis, and septic shock, you can just read them. I think we read them multiple times and it's very easy to understand. But along with the surge response, there is another response which goes on in the body, and that is known as CARS. What is CARS? CARS is a compensatory anti-inflammatory response. So when there is an inflammatory response going on, there is a simultaneous anti-inflammatory response, which is a protective response which starts in the body. And this response is initiated by the anti-inflammatory markers. And what are the anti-inflammatory cytokines which are increased in the body? This is very important. CARS is because of an increase in the interleukin 10, and there is increase in the interleukin 6. Along with there is decrease in the HLA-DR. Why the HLA-DR is decreased? Because the HLA-DR will lead to decrease in the MSC2 molecules, because they express the MSC2 molecules, and this MSC2 molecules will express the antigen presenting cells. So there will be decrease in the antigen presenting cells, which will decrease the inflammatory response. Again, Bailey and Love also mentions about these cards in a very small paragraph. Bailey and Love has mentioned about these cards. Now, what does Bailey and Love has to say? See, there is a slight contradiction with the Bailey and Love and the Saviston. What the Bailey and Love says that this counter-inflammatory response, that is the CARS response, is mainly regulated by 4, 5, 9, and 13. Now, how to remember this? 4 plus 5 is equal to 9. 4 plus 9 is equal to 13. So this, according to Bailey and Love, there are 4 markers, 4 regulators of this CARS response along with transforming growth factor beta. If you get an MCQ, we say what are the markers which are increased in CARS, 6 and 10. How is it regulated by? Then 4, 5, 9, and 13. Try to keep this clear. and both of this information has to be understood, and it's very simple to remember them. So once we have understood about the SIRS and the CARS, the inflammatory response and the anti-inflammatory response, which occurs as a consequence of the response to trauma. Now, what happens subsequently? See, whenever we hear about this car should also remind us about another mnemonic, as mentioned in the Bailey and Love, about the physiological response to injury. What are the triad of the physiological response to injury? This is again a car, that is catabolism, anorexia, and rest. So this is another card that is simultaneously asked in the exam. What is the triad of the physiological response to injury? Remember, this is taken from Bailey and Love. So whenever you hear about the car, this should also come into your mind, a mnemonic just to remember them. Now, this is a very important question. We know why there is inflammatory response. Now, how is this inflammatory response mediated? This is mediated by some mediators which are known as the cytokines. So if you try to solve this MCQ, this is going to provide you some idea about important points about all the cytokines. Important cytokines are tumor necrosis factor, interleukin 4, 6, and 5. If we know about these basic cytokines, I feel that one of this can be an exam question. All these are taken from Saviston. Try to understand which one of the following is true. Half-life of TNF is 6 minutes. Is it true or not? Interleukin 4 increases the acute phase reactants. Interleukin 6 is neuroprotective, or interleukin 5 promotes eosinophil proliferation and airway inflammation. Interleukin 5 promotes eosinophil proliferation and airway inflammation is the true statement. But why are the first three wrong? If we know the correct statements for the first three, then a lot of points about the cytokines will be covered. So let's understand about this. The first option, that is the half-life of tumor necrosis factor, it's very clearly mentioned in Saviston, about 14 to 18 minutes is the half-life. In shorts, they mention less than 20 minutes. So 14 to 18 minutes, if you can remember it, it's good. Then interleukin 4 is neuroprotective. How come interleukin 4 is neuroprotective? The entire mechanism has been described in Saviston, and it very clearly mentions that the interleukin 4 will try to promote Th2 cells, and they will try to inhibit the helper 1 cells. And by inhibiting the helper 1 T cells, they inhibit the cytotoxic immune response. And so that's how they act as the neuroprotective mechanism. Which of the following will mediate the release of acute phase reactants? Acute phase reactants will be mediated by interleukin 6. Interleukin 6 will mediate the release of acute phase reactants. So this is very important high yielding question. I believe all the 4 points are an MCQ on themselves. Now, once we have understood these mediators of inflammation and what are the inflammatory response we get, that is SIRS and CARS, let us move ahead and try to understand what happens to the body during metabolism. There are a few another high yielding topics that are going to be asked. Like, this is a very important topic from Bailey and Love. So the first figure in Bailey and Love, the first figure from the first chapter clearly mentions about the importance of nitrogen excretion. So this graph on nitrogen excretion is a very important, because this is a very reliable marker of trauma. You might get an option and you might confuse thinking the importance of nitrogen excretion in trauma. Yes, in major trauma, there is significant amount of nitrogen excretion. As you can say, they can increase to more than 20 gram per day. So a very important question, major trauma, which is an important marker, nitrogen excretion. Don't underestimate the nitrogen excretion if you get it that in the option. Second important thing is that these two statements from Bailey and Love are very important. The first thing, they clearly mention that the normal excretion of nitrogen is up to 14 gram per day, and in case of trauma, sepsis, what happens, the nitrogen excretion increases to around 20 gram per day, which is equivalent to loss of 500 gram of skeletal muscle per day. So this is a very important MCQ. I believe this might be asked in the exam, but this graph should be kept in mind. All the images in Bailey and Love are important for exam. Don't try to ignore any image. If possible, go through the images, later read the text. Now let us understand. There are a lot of responses. We will stick to the common things, the forgotten things, the ignored things first. So the next is about the F flow model. This is a very common thing which is given in detail in Bailey and Love. the F flow model. And the F flow model is very simple. It has been given by David Cutverson, and it's very important to remember that the F phase is a phase where there is decrease in the metabolism, and this is followed by the flow phase where there is increase in the metabolism, that is catabolic responses go on. So what happens in the F phase? In the F phase there is decrease in the metabolism. The body tries to save the energy for the further recovery phase later on. So the F phase will last for 24 to 48 hours, and the flow phase will resume from 3 days to 10 days. So this is a very important MCQ. What happens in the F phase? F phase, there is decrease in the metabolism, whereas in the flow phase there is increase in the metabolism, and so there is a catabolic phase. There is hypermetabolism, there is muscle breakdown, and there is hepatic protein alteration. So there are a lot of responses which occurs in the flow phase, and this is subsequently followed by the recovery phase. They might ask you like which hormones are mainly responsible for the F phase. Then it's a very commonly asked MCQ. It's ACC, that is aldosterone, catecholamines, and cortisol. A very common question from Bailey and Lowe. If we try to apply this principle of ebb and flow phase in all the trauma, in all the response to stress, there is a paradoxical event which occurs, as we can see in this image taken from again from the standard textbook, that is Bailey and Lowe. So what the Bailey and Lowe says, that standard surgery or in all cases of stress, normally there is decrease in the body weight because of the catabolism, that is the flow phase. So there is catabolism, and so there is decrease in the body weight. So that's a normal phenomenon which we know that is going to happen because of the catabolism that occurs in the flow phase. But there is a paradoxical rise in the weight which occurs in patients of sepsis and multi-organ failure, and this is a very important MCQ. They will ask you, why does this paradoxical weight gain occurs? This paradoxical weight gain occurs because of the extracellular fluid loss which occurs in these patients. And this weight gain, it's clearly mentioned in Bailey and Law that from the 10th day onward, this weight gain starts decreasing, and it decreases by 15%. As we can see in this image, which is taken from Bailey and Love, this clearly shows that most of the events of stress like surgery and starvation, there is weight loss, and this loss of weight is because of the catabolism that happens in the flow phase of the F flow model. Now, there is an exception to this, and which occurs in sepsis and multi-organ failure. Now, what does this mean? That instead of weight loss, there is weight gain. Why this weight gain occurs? This weight gain is the paradoxical event, and this paradoxical event is because of the extracellular fluid loss which occurs in sepsis and multi-organ failure, and so there is a paradoxical weight gain. This paradoxical weight gain subsequently decreases as the catabolism sets in, so there is decrease in the weight gain. This is a very important exception to the F flow model, which happens because of the certain cases there is third phase fluid loss and there might be weight gain in spite of the catabolism occurring later. Whenever there is a stress response, the demand of the body for the calories is increased, and this is a very important table which is taken from shorts. Believe me, this is a very high yielding table. Anything can be picked up as an MCQ. It's very simple to understand. They might pick up anything like what is the calorie requirement in a case of mild, moderate, or severe stress. See, in mild stress, there is no significant increase in the calorie requirement. It's the same as in the normal condition. And the number of grams per protein per day is also 1 gram per day in case of normal. In case of mild stress, it is 1.2. Now, this table, there is nothing to explain in this table. I've added this just for you to revise them before exam, because you should have a visual impression of this. It's straightforwardly, I've taken it from shorts, and believe me, it's a very high yielding table. What is the calorie requirement per day in a patient with burns? What is the total gram of protein requirement in a patient with burns? It is 2.5 gram per kg per day. So it's very, very important. Now, this energy requirement is increased in case of stress. We understand this. Whenever we talk about stress, we also try to include the surgical stress in this chapter. So whenever there is a talk about surgical stress, we always try to reduce the surgical stress by adequate preoperative and postoperative care. Now, adequate preoperative care also includes something which is known as the ERAS model. Now, what is this ERAS model? There are a lot of things which have been included in the ERAS model. This diagram, which is from Bailey and Love, this also shows how the ERAS intervention can lead to enhanced recovery or quick recovery after surgery compared to the traditional care. Now, there are a few things about the ERAS which should be very clear. For the pre-op, it is recommended that clear fluids can be allowed up to 2 hours. So this is an exam question. Again, if the patient has an FL score of 2 or more, then prophylaxis antiemetic has to begin. FL score is for predicting the post-operative nausea, vomiting probability. And also it's recommended that epidural analgesia is to be avoided in patients who are undergoing laparoscopic surgery, and spinal dimorphin is adequate single dose, or you can even give 6 to 12 hour IV infusion of lignocaine. So all these are recommended for early recovery of the patient in the post-operative period. To look at the FL score in brief, basically it's a predict the post-operative nausea and vomiting, and there are 4 criteria. This has been multiple times asked in the exam, so we remember them. For most of them, it's a female non-smoker with history of motion sickness or post-operative opioid treatment is planned. All of them has a risk of nausea and vomiting, and they're preferably given antiemetics when the FL score is 2 or more. So any female non-smoker is preferably given antiemetic. So very important. Probability is very easy to remember. Just remember them: 10, 20, 40, 60, and 80. So the probability of having a post-operative nausea and vomiting, if the FL score is 0 is 10, 1 20, FL score of 2 is 40, 3 is 60, and 4 is 80. So this way you can remember that. It can be put up as an MCQ very commonly. These are the various things about this metabolic response to injury. Just to finish, there is another MCQ. Try to understand this MCQ. It's a one-liner, but there is a lot of things behind it. That is, which of the following is raised except, all of the following are raised to in trauma except catecholamines, glucagon, insulin, and growth hormone. So all of them are raised except insulin. So this brings us to the last topic, that is the neuroendocrine response. So in neuroendocrine response, the most commonly asked thing that you have to remember is that IIT is decreased in response to trauma. So there is decrease in the insulin-like growth factor, thyroxine hormone, and testosterone. All of them are decreased. Rest, everything is increased in case of trauma. When there is a trauma, we know about the molecules which are released and where they bind to the receptors and what inflammatory response they produce. There is an activation of innate and adaptive immunity, and apart from them, there is a neuroendocrine stimulation. What happens in the neuroendocrine system is clear in this figure from Bailey and Love. What happens in the innate and adaptive immunity in the form of SIRS, we have already seen SIRS and CARS. And apart from that, what happens in the overall metabolic response, we have seen in the form of a flow model. So these are the questions which might be put up in a lot of ways. Try to revise this chapter. We are going to upload more consequent videos of this general aspect of the surgery. Wish you all the best for the exam. Don't feel upset for the change pattern. Just keep revising. We will be uploading more videos very soon. Thank you.